Hi guys, this is John Adamson, the Rehab and Documentation Guru, speaking to you from outside of Germanna Community College, where one of my children is taking classes, so I'm waiting to pick her up after class. I wanted to talk today about communicating with doctors, more specifically about asking doctors for diagnoses. And one of the things I wanted to ask you is to provide some comments about maybe some things that you found have been successful in getting doctors to communicate additional diagnoses to you that help improve the payability of your claim. So keeping in mind that I'm in home health is something important to this discussion. Also keeping in mind that Medicare is tracking two particular comorbidities right now. One is peripheral artery disease, and the other is diabetes. These are very important diagnostic codes going forward, and Medicare is going to be utilizing information related to these diagnoses. Not entirely sure how, but I do know that both these diagnoses cause themselves a number of issues for patients. So anyway, I had a patient today who had a laundry list of diagnoses, an incredible amount. And one of her diagnoses was recently she'd been treated for cancer and had gone through chemotherapy. Now, chemotherapy, one of its known side effects, obviously, is it destroys cells that are rapidly reproducing. And chemotherapy is kind of renowned for causing problems with vascular issues because it destroys the endothelial cells, and the smaller blood vessels, especially arterioles, are very susceptible to damage because of this. So I had this patient, no diagnosis of peripheral artery disease, but she clearly had signs of peripheral artery disease. She had dryness of skin, not by itself a big indicator. No hair at all distally, which in a woman not as typical. But when you work with a lot of elderly ladies, they don't care about shaving. But we see that a lot in elderly people in general, loss of hair on their legs, which is often a sign of microvascular disease. But then she had a lot of thickening of her nails. I mean, like tremendous thickening. And thickening of the nail beds is a characteristic of PAD. And then she also had what was clearly an arterial wound on one of the toes, the ends of her toe. Very small, but clearly of arterial origin. And so, but no PAD. Knowing the importance of this particular diagnosis to reimbursement and tracking of comorbidity impact, I decided that I would ask the doctor if this could be a potential problem, because not all lists that come from doctors are necessarily comprehensive. So I sent a message to the doctor just explaining the symptoms and asking if the patient happened to have a diagnosis of PAD. I don't know if this is a great best practice. I was trying to indicate I was not making the diagnosis myself, but making it clear that symptomology-wise, she seemed to have this diagnosis. So we'll see what happens from that. But again, I'm kind of asking the question, what have you found to be helpful in communicating with doctors to get better diagnoses on your orders, on your claim, things like that? And always keeping in mind, of course, that we as therapists do not have the ability to provide a medical diagnosis, but we can certainly try to suggest that symptoms seem to be consistent with, and just be objective that way. So anyway, please comment, suggest, I'm curious what you think about this particular subject. And again, please like and subscribe, suggest any future videos you'd like to see, submit any documentation examples you'd like me to review, and I appreciate you. I hope you have a good night. God bless. Take care.